Okay, so let's start looking at the bone femur. Here we're looking at the cranial view of the femur. This is actually again your right femur bone with the proximal end of the femur, the shaft of the femur or body of the femur, and the distal end of the femur. At the proximal end, the major features of the femur are going to be the head of the femur, the greater trochanter of the femur, the greater trochanter of the femur, and then we have the lesser trochanter of the femur. But lesser trochanter is on the medial side, can be seen more clearly from the caudal view, while your greater trochanter can be seen from both cranial as well as caudal view. And we see the head of the femur is more on the medial side, and we see the fovea capitis present on the head of the femur. Okay. The neck of the femur is located right below the head. Then that is your lesser trochanter. The ridge between the lesser and greater trochanter is trochanteric ridge, and the fossa between the head, lesser trochanter and greater trochanter is the trochanteric fossa. Okay. So that's here we see the trochanteric fossa, the caudal view of the bone, the lesser trochanter, greater trochanter, head of the femur, fovea capitis. From the cranial view, we see the greater trochanter again. From the lateral view, as we come further down to the greater trochanter, we see another small tuberosity, that is the third trochanter of the femur. Then, as we see the cranial view, we see the neck of the femur again, we see the head of the femur with fovea capitis located right here. Now, on the shaft of the femur, we see like the cranial surface is quite smooth because it usually just accommodates your vastus intermedius on the dorsal surface or on the cranial surface, so surface is smooth, which allows gliding of the muscles, rather attachments of the muscle. At the proximal end, we see some articular attachment areas. Those are for the one of the heads of the quadriceps that we see from the proximal end. On the caudal surface of the bone, we said there are two lips or two lines, the lateral lip and the medial lip. Those are the lips, or those are the areas again for the articulation or attachment of the muscles. So we see the in between the lips, we see the area is quite rough. At the distal end, let's go back to the cranial view. At the distal end, important structures on the bone are going to be your trochlea of the femur, the medial condyle of the femur, and medial epicondyle of the femur. Okay. The medial condyle, the articular smooth area, and medial epicondyle, which is extension from the medial condyle. On the lateral side, we see the lateral condyle and the lateral epicondyle. From the ventral view, we can see the part of the trochlea of the femur, as well as we see the intercondyloid fossa. So now this is the ventral view of the femur, where we see the lateral condyle, medial condyle, and intercondyloid fossa. The medial epicondyle is right here, the lateral epicondyle is right here. On the caudal surface of the bone, you find right above the condyles, we see like supracondylar tuberosity, supracondyloid tuberosity, and in between them you have the supracondyloid fossa. The supracondyloid fossa is the area for origin of superficial digital flexor muscle, while from both of the supracondyloid tuberosities we have two heads of the gastrocnemius muscle. They are arising from here. If you look at the proximal part of the condyle a little bit carefully, you will see there are some articular areas right here as well as here. The sesamoid bones, the fibulae, those are going to be articulated, which are present within the tendon of the gastrocnemius muscle. Okay. Now we are looking at the bone tibia and fibula, the bones which form the crus of the hind limb, the cranial view of the tibia and fibula, the proximal end of both of the bones, the shaft or body of the tibia as well as fibula, and then distal end of the tibia and fibula. As we see in this particular view, the fibula is articulated with proximal end of the tibia and also with the distal end of the tibia. But in distal one half or one third of the bone, the fibula is almost fused with the tibia. But then basically it is articulated with tibia by means of fibrous connective tissue, the specific type of joint which is called syndesmosis. We see a big space between these two bones, that is your interosseous space. At the proximal end, the bone tibia is more of triangular in nature. The dorsal view of the bone, we see the bone is triangular in nature. As it comes in the middle along the shaft of the bone, it becomes more roundish in nature, and as it goes further downward, it almost becomes quadrilateral in shape. That is the distal end of the tibia as well as fibula. The distal end of the fibula is called lateral malleolus, and the medial part of the distalmost end or distal end of the tibia is called medial malleolus. This is comparable to the styloid processes of the radius and ulna. As the lateral styloid process belongs to ulna, the lateral malleolus is part, or it is actually distal end of the fibula, and medial malleolus, which is comparable to the medial styloid process, is the distalmost part of the tibia. As we look at the distal articular surface of the tibia, as well as a part of that is formed by the fibula, but basically this articular surface of the tibia is grooved and it fits into the trochlea of the talus, and so this part here is called cochlea of the tibia. Okay, so this articular area of the tibia is called cochlea of the tibia. Okay, let's review this one quickly. The proximal end of the tibia and fibula, the shaft or the middle part, body of the tibia and fibula, and the distal end of the tibia and fibula. Okay, let's look at those bones individually, or look at major features at the proximal end and the distal end, as well as other parts of the bone. Okay, let's concentrate on the proximal end of the tibia. Here we are looking at the cranial view of the tibia. In the cranial view, what we see here, this part here at the proximal end, which is slightly flat, which protrudes in the cranial direction, or the tibial tuberosity. An important structure which is attached here is the patellar ligament. Patellar ligament is basically an insertion tendon of all the quadriceps muscles, and so that attaches right here on the tibial tuberosity. As we see the caudal part of the proximal end, as we go more caudally, we see the medial condyle of the tibia and the lateral condyle of the tibia. In between the medial and lateral condyle, you see the intercondyloid eminence or intercondylar eminence. Now these are the areas where the cranial and caudal cruciate ligaments are going to be attached. In this part we have the attachment for the cranial cruciate ligament. In this part we have attachment for the caudal cruciate ligaments, which are important ligaments of the stifle joint. Then as we look at the proximal end, as we see slightly more on the lateral side, we see a groove right here. The probe is running through the groove. That groove is for the extensor muscles, and so it is called extensor groove or sulcus muscularis. That part here, which is present on the lateral side, that is the extensor groove or sulcus muscularis. Right below the tibial tuberosity, we have tibial crest or crest of the tibia. That is another extension, or that is slightly more extended part of the tibial tuberosity as it moves further down. At this proximal end, we see the head of the fibula is articulated with the lateral condyle of the tibia. Let's turn it on the caudal aspect. Now we are looking at the caudal view of the proximal end. Nothing much is here, but then we can see the articulation between the head of the fibula and the lateral condyle of the tibia. One important thing to notice in this particular bone, if you look at the proximal articular surfaces, those are not really matching with those convex condyles of the femur, and so here we need meniscus, which is fibrocartilaginous wedge-shaped disc, which is placed between the condyle of the femur and condyle of the tibia to form the femorotibial joint. Okay, so let's come back to the bone. So what we have here, we have the medial condyle, lateral condyle. Those are almost flat or not that much concave to accommodate the convex condyles of the femur. This surface here is called tibial plateau, which again is which again is important in terms of rectifying the cranial cruciate ligament injuries. Okay, now let's move down to the distal end of the tibia and fibula. At the distal end of the tibia and fibula, we see the cranial view of the bone. In this cranial view, we see the medial malleolus, which can be pointed out more on this side. That is the medial malleolus. We see some of the grooves for the passage of the tendons. Then, as we turn it on the lateral side, that is the lateral malleolus, which is nothing but distal end of the fibula. And again, as we mentioned earlier, the grooved articular surface, that is called cochlea of the tibia. And so these are the important features at the distal end. When you look at the cranial surface of the tibia, it looks more smooth as it allows muscles to pass over. But then when you look at the caudal surface of the tibia, it is quite rough, because your popliteus muscle as well as all the three different heads of the DDF are attached on the caudal surface of the tibia. Again, the space between the tibia and fibula is interosseous space. At the proximal end, tibia and fibula are articulated with each other by means of synovial joint. At the distal end, these bones are articulated with each other by means of syndesmosis. We are now looking at the skeleton of the pes, PES, the lower part of the hind limb, or we can say hind foot. The pes, which will include bones like tarsal bones, metatarsal bones, and the phalanges, which form the digit. This is comparable to the same bones in the forelimb. The tarsal bones are obviously very different from the carpal bones in the forelimb. First of all, they are arranged in three different rows: the proximal row of the tarsal bones, the middle row of the tarsal bones, and the distal row of the tarsal bones. The distal row of the tarsal bone is directly making contact with, so that is your proximal row, middle row, and the distal row. And distal row of the tarsal bones is making direct contact with the proximal ends of the metatarsal bones. Okay, before we go further to the metatarsal bones, let's look at the major tarsal bones which are present in the dog. So as we know, there are 7 tarsal bones present in the dog. There are 2 of them in the proximal row. Then on the medial side, we have central tarsal bone, which is present in the middle row, and fourth tarsal bone, which is not clearly visible in this preparation because it is still covered with some fascia. But again, the fourth tarsal bone is going to be a taller one, which is more on the lateral side. That would be located on the lateral side. Okay, so here we have the middle row of the tarsal bones. That is your central tarsal bone and the fourth tarsal bone coming on this side, which will also go further to the lower distal row. In the distal row of the tarsal bones, we have tarsal bone number 1, 2, 3, and 4. The fourth one is again present in both of the rows. Okay, so let's start from the proximal row. We are now looking at it from the cranial view. The major structure that you observe here is the bone talus or tibial tarsal bone. If I have to outline that bone can be outlined this way. So we have all of that which we see here as well as here is the talus or tibial tarsal bone. Slightly more on the lateral side and on the caudal aspect, this bone here is the calcaneus. The calcaneus or calcanean bone is also called fibular tarsal bone because it is located on the lateral side, and it is believed to be more associated with the fibula, which is on the lateral side as well. So we have fibular tarsal bone or calcaneus or calcanean bone located in the proximal row, of the tarsal bones. And here we have different parts of the calcaneus, the calcanean tuberosity, where you have attachment of the common calcanean tendon. The trochlea of the talus is one of the important feature. this trochlea, which is pulley-like grooved articular surface, it fits into the cochlea of the tibia to form the tarsocrural joint. And then remaining part of the tibial tarsal bone is located right here. So these two bones, they form the proximal row of the tarsus. Then we have middle row of the tarsal bones, which would include central tarsal bone and fourth tarsal bone, while distal row of the tarsus would include tarsal bone 1, 2, 3 and 4 tarsal bone again. Let's see it from the caudal view. Again, in this preparation, those structures are not very clear. It has not been cleaned up that far, so we can actually see all the bones individually. From the medial view, we see the talus with trochlea of the talus and the distal part of the talus bone, the calcanean bone articulated with the talus on the caudal aspect. One of the important features that we notice here, there is a passage for deep digital flexor tendon on the caudal surface of the calcanean bone, which is called sustentaculum tali. Sustentaculum tali is the passage or smooth area for passage of the deep digital flexor, where the tendon would pass further down and then split into 4 different tendons to go on each functional digit. Okay. This structure here is a it is calcanean tuberosity. The calcanean tuberosity, also called tuber calcaneae. The calcanean tuberosity is the attachment area for the common calcanean tendon, which we know is formed by 5 different muscles in the dog and 6 different muscles in the cat. Now here in this preparation, we can also see a little area here which represents that bursa which is present between the tendon and the bone. So the subtendinous bursa is present between the calcanean tendon and the calcanean tuberosity, which can be inflamed or which can be damaged. Okay, so that's regarding the tarsal bones. Now let's move further down to the metatarsal bones. The metatarsal bones are in the dog, as we have 4 functional digits which are most commonly present. In the forelimb we have 4 functional and 1 non-functional digit or 1 paradigit, but in the hind limb most of the time the paradigit would be absent. They only have 4 functional digits. So as usual, we start counting them from medial to lateral. So we have metatarsal bone number 2. As you assume that number 1 is lost, metatarsal bone number 3, metatarsal bone number 4, metatarsal bone number 5. Same as metacarpal bones, the metatarsal bones also have their bases located at the proximal end and their heads located at the distal end. From the caudal view, we see the base of the metatarsal bone, shaft or body of the metatarsal bone, and the head of the metatarsal bone, which in this preparation is covered by the proximal sesamoid bones. So we have one proximal sesamoid bone here, other proximal sesamoid bone here. Dorsal view, we see the same structure as we saw in the forelimb. The head is typical rounded articular surface, but on the caudal aspect, it is going to have a little ridge. On both sides of the ridge, you have the proximal sesamoid bones. Same situation is there in the forelimb as well. So we have proximal sesamoid bones, 2 per digits, at the junction between metatarsal bone and the proximal phalanx of the digit, located on the plantar surface. Then on the dorsal aspect, at the same level, we expect to have a sesamoid bone located here, which is your dorsal sesamoid bone, which is within the tendon of the long digital extensor muscle. Further down, we have the proximal phalanx, proximal phalanx, proximal phalanx, proximal phalanx. These are the proximal phalanges of each digit. Then we have the middle phalanx, structurally same as forelimb, the base, the body, and the head. The base, body, and the head. The middle phalanx, similar structure. The middle phalanx right here, the base, body, and the head of the middle phalanx, and the head of the middle phalanx. So we see in this preparation the deep digital flexor muscle is still in place, which is attached to the flexor tubercle of the distal phalanx.